Hello, I am Dr. Jimmy ML. I am an orthopedic surgeon practicing at Kottayam, Kerala. I am going to read one of my health articles which was published in many health magazines in Kerala. This is on road accidents and first aid. So the first subheading, accident rate and golden hour. The major cause for death below 40 years of age in the world population is road traffic accidents. Hence it is called pandemic of 21st century. The Indian RTA rate is 6% of the total world rate, even though the total number of vehicles in Indian roads is 1% of total world number. RTA death rate in India is double that of the developed world. The chart of deaths occurring after road traffic accidents can be grouped into three peaks. First peak of deaths occur immediately after the accidents. The major reason for death in this group is head injury. It is usually non-preventable. The second peak of death occurs within first 4 hours after the accidents. This period is called golden hour. The main cause of death in golden hour is blood loss. The third peak of deaths occur in 3 weeks after the accidents. This is due to multi-organ failure. This has to be treated in the hospitals. If we can give correct first aid and ship the patient to the optimum hospital as early as possible, then we can reduce 3/4 of RTA deaths and can also improve the quality of life obtained after the treatment completion of accident victims. Number 2, control at accident site. First of all, the care providers or volunteers should protect themselves from getting injured at the accident site. Then, off the ignition of the involved vehicle, so you have to off the ignition of the involved vehicle. Abstain from the carelessly throwing of lighted cigarettes or other ignitable materials at the accident site. Otherwise, it may ignite the spilled fuel from the vehicle and produce major fire. The accident victims should be removed from the vehicle to a safer place by slowly removing the heavy objects fallen on their body instead of pulling them. If there are more volunteers at the accident site, then we should take their help also. Instead of doing everything by ourselves, we may send some volunteers to inform the police, ambulance, the hospital where we are going to carry the victims, and the relative of the victims by phone. 3. Triage and order of the first aid. When many persons are involved in the accident, they are sorted by an expert and are given different color codes according to the order of priority in which they are to be shifted to the hospitals. This is called triage. The victims who are to be shifted immediately to the hospital are given red. Second priority victims are given yellow, and the persons who may be shifted at a later time are given green color codes. Dead persons are given white, and the persons who are very serious but will not survive even after shifting them to hospital are given pink color code. The first aid provided to the accident victims are conducted in the order of ABC, or airway, breathing, circulation, bandage, splintage and transport. Number 4, first aid for breathing. First step in the RTA, first aid is examination of the airway. The breathing is checked by placing fingers in front of the nostrils. If the breath airflow is absent, examine the mouth and nose to check for any obstructing objects such as loose artificial dentures, mud, etc. If the bones of the face are broken, place the airway that makes a passage for the air from outside to enter into the lungs. If the air is not entering the lungs after the airway is kept, pierce the trachea with 5 or 6 large bore injection needles to let the air in. Next, examine the breathing by observing the chest movements or by using stethoscope. If the victim is not breathing, give artificial respiration by mouth-to-mouth breathing. This is given by making the victim lie on the floor and then extend the head of the victim and open the mouth by holding on the jaw. Keep a towel in front of the mouth of the victim. The provider takes deep breath and then exhales to the mouth of the victim by placing his mouth over the towel. This is repeated 12 times in a minute. Number 5. First aid for circulation. Next, examine the circulation or the functioning of the heart and blood vessels. Usually the heart function is assessed by palpating the pulse. Usually the radial pulse is palpated to assess the heart function. This is palpated by placing 3 fingers just below the front of the wrist on the side of the thumb of the victim and the volunteer's thumb on the back. Feel for the repeated elevations of these fingers. If the radial pulse is not available, look for carotid pulse. This is felt by placing the fingers of the provider in the upper part of the neck, just below the corner of the jaw. If this is also impalpable, then it can be concluded that heart is not beating sufficiently. If the heart is not functioning sufficiently, artificially squeeze the heart from outside for sending the blood to entire body, and this is called cardiac massage. For this, make the victim lie on a firm place and place the heel of the palm one above another on the lower part of the sternum. Keeping the elbow and the wrist straight, press the chest by giving force from the shoulder so as to press down the chest to 1.5 inches. This is repeated 72 times in a minute. In children, use one hand so as to press down the chest to 1 inch, and in infants, use 2 fingers so as to press down the chest to half an inch. Cardiac massage is continued till the functioning of the heart returns or up to half an hour. Once the heart starts functioning, place the patient in the side position or in the recovery position. If both the heart beating and the respiration are absent, give the cardiac massage and the mouth-to-mouth breathing in the ratio of 30:2, which means 30 cardiac massages followed by 2 mouth-to-mouth breathings. Next, search the body to identify the bleeders. If the bleeding is occurring from the limbs, keep them elevated to reduce the blood flow. After that, give pressure bandage by using pads and tie them with pressure. Tourniquet or tying the limbs with rope may produce further damage to the limbs and hence must be avoided. Number 6. Rapid examination and fluid shock. Examine the head, eye, nose, ears, chest, abdomen, pelvis and limbs to detect wounds, contusions, etc. Ask the victim to move to the toes, fingers and the limbs to check their movements or function. With the help of 2 volunteers, keep the victim on the side position. Identify the wounds on the back and check the tenderness behind the center of the neck and vertebral column. These examinations are to be done within 2 minutes. Fractures in the pelvic bone may produce oozing of the blood to the abdominal cavity. This may cause death. Hence, such a victim has to be shifted immediately to the hospital. A condition called shock develops when more than 40% of the whole body blood is lost due to multiple bone fractures, deep wounds, or pelvic bone fractures. The feeble pulse, cold and pale skin, fast and shallow breathing, and loss of consciousness are the signs of shock. In such a stage, the legs should be elevated to shift the blood to the vital body parts like brain. At the accident site, penetrating objects should not be removed from the body of the victim because it may cause death due to internal bleeding. Number 7. Bandage, sprindage and transport. Cover all the significant wounds by using pads and bandages. The abnormal movement in the chest and breathing difficulty due to fracture of many ribs can be reduced by strapping the chest with cloth. If the abdominal viscera went outside the abdomen due to wounds, relocate it to abdominal cavity and cover the abdomen with clean cloths. Use splints in the case of fractures to prevent further damage to the nearby tissues, blood loss, pain and edema. The available materials like wooden bars, umbrella, etc. may be used as splints to immobilize the fractures by tying them around the fracture. Use splints in the case of fractures to prevent further damage to the nearby tissues, blood loss, pain and edema. The available materials like wooden bars, umbrella, etc. may be used as splints to immobilize the fractures by tying them around the fractured limbs. A square-shaped cloth may be folded to form a triangular sling. This is used for immobilizing upper limb fractures. A fractured lower limb may be immobilized by tying it into uninjured lower limb with the help of 4 cloths. The possibilities: a fractured lower limb may be immobilized by tying it to the uninjured lower limb and with the help of 4 cloths. The possibilities for vertebral fractures are high if there is tenderness behind the center of the neck. If the neck moves in such a victim, spinal cord may be damaged by the fractured vertebral column to produce paralysis of the limbs. Hence, in such persons, the neck should be immobilized using hard cervical collar. If there is tenderness on the back of the center of the chest or abdomen, the victim should be shifted to the ambulance by 4 persons like a log of wood or without bending the victim's body. 8. Matters related to the hospital. The decision to shift to the respective hospital is made after considering the financial status of the victim and the type and seriousness of the injuries. If the treatment for the specific injuries of the victim are available, it is better to shift to the nearby hospital. The head injuries patients are to be shifted to a hospital where CT scan and neurosurgeon are available. The amputated body part should be placed in a clean plastic bag, which is placed in another plastic bag containing ice cubes, and the bag is tied safely. This should be carried within 6 hours to a hospital with microvascular surgical facility. Victims with severe muscle or soft tissue loss are to be shifted to hospitals where facilities for plastic surgery are available. Hand injury: victims may have tendon cuts which require suturing, and hence they are to be shifted to hospitals having orthopedic or plastic surgery departments. In order to undergo anesthesia for major surgery, the patient has to abstain from taking food and drinks for 6 hours. Seriously injured victims should not be given food or drinks after the accident because they may require major surgery. After transporting the victim from the accident site, instead of forsaking the victim in the hospitals, intimate their relatives. Give the doctor necessary information to write the police intimation, and also, if necessary, arrange for blood transfusion. Number 9. Causes and solutions. Driving after consuming alcohol must be avoided because even with minor quantities of alcohol, decision-making capacity, coordination, muscle strength, vision and hearing may be impaired. Drunken driving, sleepy driving, overspeed, non-use of seat belts or helmets, use of mobile phones during driving, careless and disobeying of traffic rules may cause RTAs or make the injuries more grievous and hence must be avoided. Those who drive the vehicles must rectify their health problems by undergoing time to time health checkups and treatments. Those who are like fever which causes tiredness, those with recurrent heart pain, fits and dizziness etc., and those who have not taken medications that cause tiredness like that of allergy should not drive vehicles. In the circumstance of increasing RTAs and treatment expenses, everyone must take road traffic health insurance, well-equipped first aid box in the vehicles, and first aid training to all vehicle drivers and travelers can cause reduction of RTA deaths and improve the quality of life obtained after the treatment completion of the injury. So that completes the article. Thanks for your patient listening. If you want to read similar articles, you can visit my personal website drjimmy.net, doctorjimmy.net, and you can contact me by mobile 944 644 1698 and Indian code is 0091.